Hi everyone. In this video, we'll be talking about the Supplemental Security Income, which is a federal income supplement program funded by the U.S. Treasury General Funds. It's mainly designed to help aged, blind, and disabled people who have little or no income through providing cash to meet basic needs for food, clothing, and shelter. Once an individual qualifies for Supplemental Security Income, or the SSI, they automatically become eligible for several other assistance programs as allowed by the federal and state law like Medicaid, QMB, food stamps, and HUD. However, because of the strict eligibility criteria of SSI, many applicants do not get accepted to join this program. This is why critics claim that young adults who exit supplementary security income after their age 18 eligibility redetermination may have greater health-related unmet needs than those who remain on SSI. The policy is also being criticized for overlooking persons living alone or with non-relatives. Thus, for them, policymakers have an incomplete picture of the living arrangements of persons with disabilities. Let me share my screen with you. Looking how this SSI policy was created, it was created by the Social Security Amendment of 1972 and is incorporated in Title 16 of the Social Security Act. This program began paying out benefits in January 1974, and it replaced a combination of approximately 1,350 different state and local programs. There was a debate in both House of Congress in the early 1970s on whether children should receive benefits from the SSI program and what the medical eligibility criteria for them. For this, a congressional staffer inserted a phrase about benefits for disabled children into the 1971 version of the House bill. This phrase remained in the final version that passed both House of Congress and that was sent to President Nixon for his signature. This program has a very important social impact on society. It increased the safety net for families, and the map reveals that the state with highest rates of SSI enrollment tends to be in the South, while many of those with low enrollment are in the West. The categories joining this program are Hispanics and Blacks, who are concentrated in the younger recipient groups, and whites are a majority of recipients between the age of 18 and 0. Black male and Hispanic females are particularly apparent among child recipients. Asian are concentrated in the age 18 to 40. And Native Americans are represented evenly and sparsely throughout the under 40 age range. SSI provide access to essentials also, which give us another additional benefits, which are benefits for housing, food, health, and social services. Also, what is more important is the Medicaid benefits tied to the SSI eligibility. This is why SSI expenditure results in massive cost savings, since appropriate use of these benefits can prevent acute medical crisis, homelessness, criminal justice involvement. In addition, food insecurity rises before initial SSI receipt and falls afterwards. The manifested goal of SSI is to provide assistance to elderly and disabled individuals who have limited financial resource. This is the manifested goal. However, some critics believe that beneficiaries do not use the welfare as it was intended, as many parents are seeking to get their children taking SSI benefits by overstating the severity of their medical conditions. SSI has also a very important economic impact. For non-elderly adults, it provides a transfer of income targeted to disabled individuals who have limited capacity to obtain financial security through their own paid employment. And for children, it provides a transfer of income to families who have to contend with the burden of caring for a disabled child. The benefit amounts, however, is reduced by $1 for every dollar of countable income, and the maximum monthly benefit is adjusted annually for inflation. For everything happens in our life, there is an opportunity cost. The GAO, which is the Government Accounting Office, identified that high risk list for possible wasteful spending is because this disability program emphasized medical condition in assessing an individual's working capacity without adequate consideration of the work opportunities afforded by advances in medicine, technology, and job demands. Also, the volume of overpayment made to SSI recipients who no longer should have qualified for benefit has almost doubled in the past decade, which is a huge increase and a very unfair burden to taxpayers. Looking at SSI from the political point of view, we see that by the late 1970s, the administration of Carter successfully pursued legislation to stop the growing cost of the Social Security Disability Insurance Program, which uses the same disability determination process as SSI. After that, President Reagan administration focused on trimming the disability rolls, but was faced by huge political backlash after publishing shocking life stories of those who had their disability benefits terminated. This backlash led to Social Security Disability Benefits Reform Act of 1984, which effectively reversed the Carter reforms. The 1984 law required the SSI to develop new standards, which ultimately led to looser eligibility requirements. Child SSI application and awards increased dramatically in the early 1990s due to the Supreme Court Sullivan versus Dabley decision, which eased disability criteria for children, particularly those with mental disorder. Since 1997, no significant legislative changes have affected children eligibility for SSI benefits, though the number of recipients has increased consistently over time. In 2019, Democratic President nominee Joe Biden released a plan to increase the program finances and benefit, especially for beneficiaries facing economic hardship through expanding SSI to improve financial security for many older adults and people with disabilities. This program has been evaluated by many people. We cannot ignore that the SSI is a complex program and it's not a single service provider. It gives benefits which are very generous compared to TNF cash benefits award and are indexed for inflation. So this is why from 2000 to 2015, the program expanded by over 50%, which means that the program is helping more people and that more people are applying to receive the SSI benefits. However, for some critics, the program benefits is the same for disabilities, whatever is the severity of it. So communities suffering from radiation exposure, to those accessing AIDS treatment, to those requiring services for addiction or genetic disorders, or for under being labeled as disabled with no specific categorization. It also has been criticized for reducing labor force participation and savings among older adults in the year leading up to their eligibility for elderly SSI benefits. For some critics, the program does not equip children also for the labor market when they grow up. It also taxes parental earnings and it does not explicitly tie benefits to childcare or healthcare costs. Others believe that SSI negative effect on the labor market not only extend to the non-elderly disabled, but also to the family members who might depend on the benefits received by the disabled family member. Same time, the program has proven that Medicaid, which is tied to SSI, improved adult health outcome by improving the functional capacity and this reduced the SSI disability benefit received during adulthood. Many researchers and government leaders actually proposed to adjust the SSI program's medical eligibility criteria to make changes in the level of benefits and changes in the phase-out rates. For example, Lever et 2019 believed that a modest increase in SSI benefits above the 2017 maximum of $735 per month would likely lead to significant reduction in poverty among the elderly. Dugan 2015 believed that a better reform would move full responsibility for funding and administering SSI to state governments. Also, Daly and Dagan proposed having work training programs for individuals with mild disabilities as workplace accommodation and assistive devices can enable many disabled people to function in a job, especially the white-collar job. Smith identified that Biden plan would set the federal SSI benefits to equal 200% of the federal poverty level for single adults. It would also increase benefits for married SSI beneficiaries, eliminate rules that reduce benefits for people receiving non-cash help from family members, and relax the asset test that restricts program eligibility, which would sustainably reduce poverty rate for older adults and people with disabilities. Hope this helps in clearing up this program, and bye-bye for now.